Thank you all for being here. This is OVP's Big Table Talk tonight. This is the first Big Table talk that we have facilitated and hosted, and we're really excited to be here to be doing it in partnership with the National Institute for Criminal Justice Reform. So we have part of the team here from NICJR. We've been working with them for about a year. Many of you here know and love Director Shante Jackson. There in the corner. But for those of you who don't know, she is the director of the National Offices of Violence Prevention Network, which is a part of the National Institute for Criminal Justice Reform. So we are so thankful to have her and her team here to help facilitate this discussion tonight. As most of you know, the point of a Big Table Talk is to provide space for community to come together to connect and address challenges that we all face. And I'm looking around the room tonight and through the list of RSVPs, and everybody here, at least those of you that I know and have connected with in the past, I know that everybody here is passionate about the work that we do as a collective, and we being everybody here in this room, not just we as OVP. And so we're grateful for everybody that took the time out to be here tonight. And so what we want to go over is a conversation about what we have been building in partnership with NICJR to be the strategic plan for violence reduction for the Office of Violence Prevention and the City of Columbus. Most of you have participated in our convenings since February of 2024, and through those convenings, we have had multiple conversations about our respective organizations and the city, where we're serving, where we're seeing gaps, where we're seeing duplications. And so we want to dive into what we as a team have put together through the facilitation and conversations, not only with NICJR, but through the conversations with you all at our convenings, as well as the community conversations that we as an office have been holding throughout the community, really since our inception a little over a year ago. So there should be notebooks at your seats. Feel free to take notes. Those are yours to keep. If you need pens, there's pens at the front, or one of our staff members can get those to you if you need to be taking notes. And then be excited for a facilitation by Director Jackson here shortly. So what you see behind me is just a brief timeline of where we are from our inception as a concept in February of 2022 all the way through the present. For those of you who don't know, Mayor Ginther declared gun violence a public health crisis here in Columbus in February of 2022. And I see a lot of folks here from CPH. And what that did was that spurred CPH to undertake months of research and intensive public hearings in order to make recommendations to the mayor of exactly what that meant. What did gun violence as a public health crisis mean for our city? And what could be done about it after those months of research and investigation? And so in October of 2022, Dr. Roberts and her team formally made the recommendation to the City of Columbus to create an Office of Violence Prevention as a #1 recommendation to that declaration of gun violence as a public health crisis. Because what they saw was that we as a city are so blessed to have just an innumerable amount of programs and resources to address violence, whether it's through prevention, intervention. But what we were lacking was a coordinated effort to make sure that we weren't duplicating, to make sure that we were servicing those gaps, and that we were really doing all that we could as a city and to reach that potential that we all know we have collectively here, whether you're an interruption group, whether you're an intervention provider, whether you're the courts, whether you're a city agency, whether you're just a community member interested in getting involved in this work. And so forwarding to March 2023 was when the mayor officially announced the creation of this office. And beginning of April 2023, all the way to the present, we have listed just a baseline of things that our office has been undertaking. Building a violence prevention inventory. We've provided race, crime, and violence trainings across the state. We've contracted with the National Institute for Criminal Justice Reform, hosted community events. And when we say community events, what we mean is we hosted a series of spring break activities across the city where we serviced over 1,000 of our community members to give children in the city of Columbus something to do over spring break. We've hosted over 25 very specific community conversations ranging anywhere from 10 individuals up to over 200 individuals to take in feedback from our residents here in the city as to what they want to see the city and the Office of Violence Prevention providing with regard to the work that we do. Those were very strategic. We invited the public at large to some of our community conversations. We visited incarcerated individuals in prisons and in the jail to have conversations with them about what they need as far as services from the city. We spoke to foster youth. We spoke to individuals who were unhoused, you name it. We really tried to make sure that we were reaching into our community and bringing in the voices of those who often don't get included in these conversations. You know, those of us in this room that are part of the city or part of the county, we're always at the table, thankfully. But a lot of our community members are not. Their voices go unheard. And so we really feel like as an office that our work cannot be for all of Columbus if the feedback we're not taking in is not from all of Columbus. And so that has been guiding a lot of the work that we've done from April. We've also started working with NOVPN under the direction of Director Jackson to have convenings of all of our community violence intervention groups, most of which I see here. And we can't thank everybody who's participated in those enough, because the strides that we have made as a collective since February of 2024 has just been immeasurable. And so thank you all. Just as a side note, I know I always say thank you, but truly thank you. You guys are so valued in this work. And I just can't wait to see where we go from here. A few technical things that we have been able to put out is that we have been getting technical assistance and training from NICJR. We released a Columbus Violence Intervention Landscape Analysis report last month, and we are working on releasing, with NICJR's assistance, a cost of gun violence analysis, which will be released, slated for mid-November, that will be able to tell us exactly how much we as a community are investing every time there is a shooting, a non-fatal shooting, a homicide in our city, and what those numbers look like, whether it's on the front end from law enforcement response all the way to the back end of what it's costing in hospitalizations, in prosecution, you know, taking a case to trial. All of those things will be included in that report, and that's not something that has previously been done for the city of Columbus. And so we're really excited to see that measure and then take that and talk about with all of you what that means and how we could be better focusing our resources, whether it's on the front end or do we want to be more responsive to the back end of what that means. And so now I'm going to, did I miss a slide? No. Now I'm going to introduce Ms. India Duke. She is our Public Information Officer with the Office of Violence Prevention. She's going to take you through the next few slides, and then we'll continue with our conversation.
Don't act like y'all ain't want to clap. Hi, everybody. My name is India. I'm the PIO for the office, and I'm just going to walk through just kind of where we're situated currently as it relates to violent crime, and as well as touch on a little bit of our mission statement with you all. So, as you can see, this is currently where we stand as far as violent crime. As of yesterday, I don't know if you all are aware of the numbers, but the city has experienced 87 homicides, which is down, fortunately, 28% compared to last year. This day last year, we were sitting at 121 homicides. Additionally, there have been 1,280 felony assaults to date, which is also down from last year by 28.25%, compared to the over 1,700 from last year. Looking at these numbers, 70 of the 87 homicides were attributed to gunshot wounds. That's 80%. That's actually technically a little over 80%. So being able to look at the numbers in this way, It gives us a clear view into the issue itself, but also allows us avenues to start developing solutions. As you heard Director Shack mention, we collected community feedback over the last several months. I'm sure y'all tired of seeing us a little bit, but it's okay. And we use it to develop our mission statement, and it reads as follows. In partnership with the Mayor of Columbus, the Office of Violence Prevention empowers residents and deters violence by delivering direct services, coordinating community resources, and evaluating programs through a public health lens. With this in mind, we were able to establish our tagline, which is #SaferTogether. As a community, violence doesn't impact a single person, but leaves a mark on the entire community as a whole. And so now you will hear from our director and some of our other team members about the 3 pillars that will represent the office's internal and external responsibilities, along with the strategies for achieving them. So Director Shack will cover coordinating safety support services. Our data and policy coordinator, Zeta Jenkins, she will cover engaging in advocacy and program innovation. And our community relations coordinator, Jamar Harris, will speak to you a little bit about the final pillar, which is fostering collaboration and coordination. So Rena.
Good job, again. So what we want to stress is this is exactly what we're having the conversation about tonight. So make sure that you're taking in these 3 pillars, because this is what we want your feedback on. We have created these 3 pillars. We'll ask questions in a second. We have created these 3 pillars from taking in all of the feedback through our community conversations and our convening. But these are not set in stone. This is what we have heard and what we have taken in. But we want to make sure tonight that after you hear what we think we have heard from you, you are giving us clarification on what you think we need to do going forward. If you think these are great, that's great. If you think we completely messed it up, that's great too, because we need to hear from you about where we need to go to make this work better. And so this is exactly the conversation that Director Jackson will be facilitating with you all. I will be speaking on the first pillar, which is coordinating safety support services. And what it is it's rooted in what our direct services will hopefully look like to the community. First, under this pillar, we will evolve group violence intervention. And so most of you know this work has already been in progress and is already in progress through Columbus Violence Reduction. What we've been able to do as a city is to move the CVR under OVP's umbrella so that we can continue to make sure that CVR has the resources they need to continue to serve the most likely to shoot or the most likely to be shot in our community. Additionally, we'll continue to work to establish proper data collection systems and to track data and outcomes so that we can continue to hopefully increase resources for the group violence intervention methods. The next strategy that we are currently building is a cohesive CVI ecosystem. In order to place all of our CVI programs in respective lanes and to focus on doing what they do best in order to achieve the maximum potential of each organization. This ecosystem will hopefully address the root causes of community violence and deploy services to residents, including creating a coordinated emergency response program, service provision backups, allowing organization services to intersect and not duplicate or create gaps. We'll be able to provide certification training for all of the CVI organizations that are involved in the ecosystem. We'll clarify service types, and this simply means knowing what services each organization is providing and where we can co-refer to each other, which again, I think to this point, we have been doing a really great job so far since we've started this work in February of 2024. This also includes funding, training, and expanding violence interruption services, which there is a difference between intervention and interruption. And for those of you who may need expanded information on that, we're happy to provide it. The third strategy is to deliver comprehensive victim services. So as we know, victim services look different for everyone, and depending on what type of violence a particular victim is experiencing, even if that means a cross-sector of violence. We'll implement new programs to support intimate partner violence. We'll build out domestic violence services with the city and with the county. We'll implement an abuser intervention program, including supporting and defining victims of and addressing child abuse as well as sexual assault. And this is in addition to victims of violent crime as well as gun violence. It's also important for us to empower returning citizens as a core tenet of the work that we do. That's going to be through adopting and expanding employment programming, the evolution of hiring practices as city or city agencies, and expanding direct hire programs to prisons. We will also be undertaking work to host record sealing clinics in partnership with agencies like the Public Defender's Office or Columbus Urban League, and the list goes on. And then last is to enhance youth services. We know that, especially within the last couple years, there really is a need to address the services that are geared to our youth to make sure that we are stopping that increase from just kids being kids to kids getting in some serious trouble. And so we want to make sure that we are empowering the organizations in our community that are providing youth services, but also to use data and inform practices to make sure that the services that we are providing are the correct services based on what our kids need. So that's Pillar 1, and it's an overview of Pillar 1. And so I will hand it off to Zeta Jenkins. She is our Data and Policy Coordinator to talk to you about Pillar 2.
Good evening, everybody. Thank you for being here. Like Director Schack mentioned, I'm going to be discussing Pillar 2, which is titled Engaging in Advocacy and Program Innovation. So we're going to break this down into 4 strategies of how we're going to do this, and I'll go through each one just as Rena did. So the first on here is to conduct routine programmatic evaluation. And what this would look like for us is identifying an academic research partner, securing funding for program evaluations, establishing data sharing agreements, and creating a system where we can really figure out what's working and how can we really lean into what is working. The second strategy that we have is to implement grant making. Simply put, we're trying to ensure that we are getting the city funds into the community-based organizations that need it. This is a priority for us. This is a strategy we're outlining. We will do this through developing some best practices, also identifying funding gaps that currently exist to make sure that we're putting the money in the right places where it's needed. The third strategy up here is providing training and technical assistance, and this can mean a variety of things. Essentially, this is us saying that we want to be of service to the community-based organizations here. So whether that's helping with skills assessments, coming in and doing contract training or a grant writing training, we want to be there to build up the capacity of our organizations to be the best organizations they can be. Finally, within this pillar, we are going to engage in policy development and advocacy. And for us, that is violence reduction policy at the local level, but also the state level and the federal level too. We want to reach those places. So those 4 strategies all make up Pillar 2 about advocacy and program innovations. And now I'm going to pass it off to Jamar Harris, who's going to go over our 3rd pillar.
All right. Hello, everyone. Again, I'm Jamar Harris, the Community Relations Coordinator for the South Side and the East Side. I'm going to be presenting you the 3rd pillar, fostering collaboration and coordination. And our strategies are engaging stakeholders, the first one. This is something, and one of the reasons why this office came about is because we know that Columbus is resource rich, but a lot of these organizations are working in silos. So one of the things that we want to do is create incentives for organizations to work together, connecting with our business owners, and trying to figure out ways to be able to create this knowledge to be able to be accessible to everyone. Did I go? Did I? Yep. Yep. Oh, I'm going to stay here. All right, my bad. The second one is to build community capacity. This one is being able to have that community feedback, right? So we were having these community relations or these community conversations, having these town halls where we'll have everyone together and be able to voice their opinion and be able to hear the people and being able to have the cadence to say, you know what, we're not just having this one time. We're going to continue to have these conversations to be able to continue to hear what you have to say and be able to implement it and bring it back and be able to continue to be a part of the solution. And then our third one is coordinate interagency partnerships. And this is strengthening our partnerships with the inner city as well too, with public health, CVR, all these different agencies who are all a part of who we are. We want to continue to build those relationships and be able to fold in administration offices to be able to get buy-in, because we know things sometimes work from the top down. Being able to identify the gaps and the needs, so therefore we can get buy-in. Also creating the Criminal Justice Coordination Committee, strengthening these agencies, also being able to strengthen our relationships with the county and also with the schools, with jails, hospitals, creating these relationships so therefore we all work into one, because we know the saying is, if you want to go, go alone, but if you want to go too far, we go together. All right? And that is our third pillar. Oh, sorry. Got the introduction of someone really important in here. So next up, I'm going to bring up the director of Ms. Shantae Jackson, the director of the Office of Violence Prevention Network, as we continue this presentation. Thank you.
Let me move my stuff out of here for you so it's not, I won't be here. Good evening, folks. Oh, that's loud. It is good to see familiar faces. It's good to meet some new ones. For those who have not met me, Shantae Jackson, Director of the National Offices of Violence Prevention Network. I feel like I live in Columbus now because I'm here every couple of weeks. I think somebody in the back was like, did you find your apartment yet? It's been a pleasure to get to know y'all. Again, for those who haven't met me, I am someone that walks and talks. Anybody else in the room walk and talk? Help you think? Okay. I don't feel alone. So over the next hour and 13 minutes, we want to hear from y'all, right? In order to co-produce a plan that is Columbus's plan, we got to make sure we got this stuff right, right? And so while Raina and her teams work around these pillars and these strategies come directly from the dozens and dozens of community-based conversations that they've had with you all over the past year or so, we still want to double check and make sure we got it right. Because at the end of the day, in order for communities to be safe, the plan has to be something that you create together, right? It can't be something that's owned by a mayor. It can't be something that's owned by an OVP. It's got to be owned by your community, because it's going to take all of us, right? Which is why their hashtag is Safer Together. Make sense? All right, so she already warned y'all that I'm somebody that likes to move people around in rooms, so I'm hoping everybody ate. I'm not gonna move folks around right away, but know that we'll be doing that in a couple of minutes. I'm interested in your initial reactions to what you heard. Know that there's a microphone right here. We wanna make sure that this gets recorded because we will be sharing it publicly so that folks that aren't in this room have the opportunity to hear what was said in this room and they can provide feedback so that, again, we're creating a plan that makes sense for all of Columbus. So if anybody has any initial reactions to the pillars that were shared, feel free to make your way to the mic. We'd love to hear that now. As those folks are making their way to the microphone, just want to share with you kind of how the rest of the night's going to go with us. I'm going to specifically be drilling into each of these pillars and asking some very pointed questions. Because again, I need to make sure we got this right. Like when we publish this plan, nobody in Columbus should be like, but they forgot. But what about what's happening over here? What about Linden? Right? All of this has to be included in this plan. So we'll go pillar by pillar, and I'll ask them very specific questions. Then we'll break out into 3 groups. You all will designate someone in your group to kind of do the broader readout of that group, but those groups will be broken out by pillars. Any questions about what we're gonna do tonight? All right. Did I see you walk up to the microphone? Come on up, sis. Tell us what your name is.
My name is Vanessa.
Vanessa,
Yes.
are you a resident of Columbus?
I am.
And what neighborhood do you live in?
I live near downtown.
Near downtown.
Yes.
Thank you. Vanessa, what you got?
Okay, so I grew up in Columbus my whole entire life. I have a vested interest in this program because I have numerous family and friends who are dealing with gun violence. My family has suffered from it, and I'm just really interested to know what the program is doing as far as data. I took some notes. It stated that data is what's working and what is not working. That's what you guys are trying to get to the root of. And I'm here representing all of those individuals who cannot be in the room. I'm not for sure. I'm looking around the room. It's a great mix of people, but I want to see more of the troubled individuals, those who are actually out here in the streets committing the crimes. I want you guys to engage in those individuals. I have a nephew who is currently serving 33 years in prison for a gun charge. He did not get those 33 years by himself. I feel like I am responsible for some of those 33 years fall on me. Some of those 33 years fall on his parents, his grandparents, and the community as a whole. So I would love to see you guys, if you're trying to collect data, to have those individuals in the room and whom you are talking to. Because if you're not speaking to those individuals, your data is skewed. I understand the purpose of data, and all data is good data, but I'm trying to make sense of where the data is coming from. If you're not talking to those key individuals and you're not working with those key individuals, I don't understand how your data, you're gonna get what you're looking from. You're gonna be able to extract what you're looking from the data that you're currently collecting. If you don't have those individuals a part of these type of meetings. And I think you have to take it to those individuals too. Move outside of these 4 walls and actually go and speak with those individuals. I don't have much time, but I so appreciate what you guys are doing.
Thank you, Vanessa, for your point. I'm going to start here. If you're okay with that, feel free to piggyback on this. I would offer that, quite frankly, Columbus is not capturing the level of data that it needs to. And so right now, there aren't really a whole lot of data-driven decisions being made. For folks who don't know me, what you're going to come to know about me is that I'm a tell it like it is kind of person, right? Maybe that's about where I come from and my background and my family and my history. So your point is well taken. These conversations can't be limited to rooms like this one. That's a conversation that I've already had with partners here. And the OVP is dedicated to making sure that we get feedback on this plan, not just from those folks that are providing direct services, not just from folks who typically come out to these sorts of meetings, but more importantly, the ones that don't. Right? And so that speaks to folks who are criminal justice system involved or who are victims or survivors, depending on what you prefer to be called. So it is our intention to make sure that we're going into other places and spaces to gather feedback on this plan.
Okay.
Thank you.
Last thing I wanted to say is that I would love to see more individuals who have lived experience working with these youths, because I know that this group is a hard group to actually reach and connect with. But I believe that if you have individuals who can share in their life experiences, it would go a much longer way than just individuals with degrees.
I hear you.
What's coming from the books. And
So that is actually a part of Pillar 1, the second bullet, developing a cohesive CVI ecosystem. A part of that, and
So much for your time. I'm gonna listen to what you have to say, but I have to take off.
And so what I'll do is explain it to the rest of the room. We appreciate your feedback. And I saw a lot of heads nod when you made your point. So whether you have to leave or not, I want to make sure everybody's getting the benefit of what you shared. So a part of the development of the CVI ecosystem is to make sure that we are empowering folks with lived experience to be doing this work. Just by show of hands, just so you know, Vanessa knows who's in the room, who are direct service providers in the room? And keep your hands up if you have lived experience. Whether that means that you are a direct victim of violence, whether gun violence or other types of violence, a former perpetrator of violence, someone with a criminal justice system background, anyone with lived experience. And so I would offer that we've got folks already in this space, occupying this space, but it's never enough until there is no more violence in Columbus. And that's what this plan seeks to accomplish. Thank you for your question. Any other overarching thoughts from folks about what you heard in pillars 1, 2, or 3 before we start to do some deep digging? Come on up to the mic. I said you gotta walk to the mic. Didn't I say that, y'all? I'm sorry. We wanna make sure that folks who are, the mic has to stay there for the purposes of the camera. It is why it's there. You got in a couple of steps today. Proud of you.
How's that? All right. Hello, Ronald Murray, Equitas Health, Stonewall, Columbus, he, him, his. The question I have is in Pillar 3. You're talking about collaboration, coordination, and engaged stakeholders. And my question is, where's the list of your community stakeholders and your community groups that you've engaged with to come up with these plans, and what do they look like? Specifically, what LGBT groups have you worked with, or LGBT groups of color you worked with, or trans groups, or things like that specifically, because sometimes we all become targets of this violence, and especially in these particular communities that we're living in right now.
I'm gonna hand that over to the Office of Violence Prevention to answer.
Thank you. Thank you for your question. So what we have done so far was one we started about a year ago. We have 3 community relations coordinators, and they were each tasked with 2 different zones each for the police zone. So we have 6 police zones. And their goal was to go out and to begin creating an inventory of service providers or resource providers. Am I where I need to be? I'm just gonna pretend like this is where I need to be, of resource providers in the city. And that spans anything. So we put a call out to whoever wanted to be included, and we also tried our best to seek out. We are never done building that inventory. We hope to never be done building that inventory because we hope to continue to grow our relationships. I guess our attempt is kind of twofold, right? So one is to create an inventory so that we know what's happening in our city and what is being provided, but also so that we can include that on our website and our social media, so that when the community is looking for where they can go to our website and say, or our social media sites and say, I need X, Y, and Z. This is who's providing it in the city. This is where they're located. And so we're still working. The city just transferred all of our website information to a new platform. And so we're working on building an interactive map that our residents can go to, and whatever they're looking for will be on there. And so if we have not connected, please let's make sure to connect, because you're absolutely right. And I will say that we have not, again, we have not finished with that inventory. It is something that we're continuing to do every day. However, when we are looking at what you're talking about with engaging stakeholder groups, a lot of what we've been focusing on in the last 6 months have been CVI focused groups. So groups that are offering intervention services. There are so many groups here and across the city that are offering prevention services, victim services. We have tried our best to connect with as many of those as possible. We are not done. We will continue to do that. But we've really focused in partnership with NICJR into that CVI space for the last 6 months. And we've really been heavily leaning into that space in order to create that ecosystem. Once that is off the ground, we will continue to provide resources to everybody in the city. And so again, we can make sure to get your contact information.
Ronald, I'm going to come back to your question. So one of the recommendations made directly by me to every city that I go into is that in order to co-create a plan with a community, you've got to understand its micro communities. And so Columbus, like other cities that we provide consultation for, has been advised that you should be having these discussions with members of the LBGT community and the faith-based community and your First American community and your returning citizens community, right? By way of background, I'm the founding executive director of the OVP in Baltimore City. And I had 36 community conversations before the plan got finalized. We included over 13,000 Baltimoreans in our discussions, 3 youth conversations, right? Those micro communities that we talked about, discussions at the district level or the council level to make sure that as many voices as possible were a part of the conversation. And it's the reason why our plan is considered Baltimore's plan. Columbus should be doing the same thing, right? To answer your question, like, who have you talked to in the LBGT community to contribute to this plan? And so I would offer that as members of this community, folks who work, live, play, worship here, hold your OVP accountable. Make sure that they're doing that. I hope we answered your question collectively. Yes, sir.
Hello, everyone.
What's your name?
Ralph Carter. How you doing, everyone? So my question is, in what pillar, and maybe y'all might have said it before I walked in, does the youth fit in? And I know the lady just mentioned about and employing and hiring and getting people in that space. There's also youth that can speak to other youth in that space and getting them where they need to be, and again, offering them jobs to be able to go out and speak because they look at us like we owe. And I'm gonna pick on Jalen a little bit. I done had Jalen since he was 14. Now he's 20, and he is working with the organization to be that young person that can ultimately really benefit from a job to help in this space. So I just want to know what pillar does that fall under?
Yeah. Wait, need the mic? I could just yell.
Ralph, I would say all of them, all the pillars. I mean, youth are no different than anybody else in our community. It just their age is different than that of an adult. And so pillar 1 at the bottom where it says enhance youth services, that's obviously enhancing direct provider services to our youth. But that doesn't mean that they can't fit in pillar 2 and help us advocate on the local, state, and federal level for better resources for youth, whether that's incarcerated youth, foster youth, youth that are finding themselves homeless, I mean, you name it. And then 3, fostering collaboration and coordination. I know that he has been with you for that many years because I've seen you guys. I've been with you on the street for that many years, and the work that you do is incredible. And so having his voice to collaborate with youth groups or groups like yours that put so much into the youth is just as important as any other pillar, in my opinion. So I don't think any one is where youth fits in because youth are no different than you and I. Youth is across all aspects, and they can be engaged in all of it.
You said Carter, right? So I guess I would piggyback on this just a little bit to add some specificity around pillar 1, this last strategy here around enhancing youth services. So in meetings with the OVP and coming out of conversations with community members, what I heard the OVP say was, we want to make sure that there are more diversion options for youth who are criminal justice system involved, so that they don't become criminal justice system involved out of the gate. I've heard them talk about the implementation of restorative practices in elementary and middle school so that young folks are learning how to deal with conflict in healthy ways in those early years, right? I've heard them talk about parental engagement along this same front. and what supports we need to be providing to families to ensure that youth are getting the supports that they need. I've also heard them talk about things like making sure that it is Jalen, right? I try to remember names, right? Our names are important, but they humanize us to each other. So that folks like Jalen are a part of the conversation, that folks like Jalen are driving the conversations, right? We don't give our youth enough voice. And so in Pillar 3, you heard us talk about making sure that we've got a youth council, right? So to Raina's point, the engagement with young people happens across the entirety of the strategic plan. Quite frankly, a 5-year plan should be built with the youth in mind because they inherit what we leave, right? And that's not to say that we shouldn't be looking out for our elders, that we shouldn't be looking out for other folks, but it is to say that we've got to make sure that our future generations are taken care of as well. Any other closing kind of thoughts around this before we start to dig in? Oh, we need you at the microphone. You want to just ask it here?
That's fine.
All right.
Thank you. Hello, everybody. My name is Curtis Delaney. I work for the End Violence Program as a peer recovery supporter. I'm 54 years old with 17 years of incarceration, 4 penitentiary numbers. My entire life up until 3 years ago was street, jails, and recurrent death episodes. For the last 4 months of my life, I've been a participant in a community agency where they offer me an opportunity from my life experiences. Things with guys like me and them real life experiences, they don't want to come in the room and sit in this room and get their life experiences and then feel uncomfortable and feel judged. They don't want to come in the room and tell you what's really going on, what time it really is from the street that they come from, and then it's all of a sudden apprehension and there's no room for us in the room. And the only thing we did was come in the room and tell you the truth. Only thing I did was come in and just tell you I left the trap, but I don't get how I sell dope no more, but I know him. So I can go in the middle of the night because my credibility is because I don't get how I sell dope no more is the reason why they let me on that street to stand there with a camera and take whatever it is for community intervention. If them the people you really want like me and them guys, we got rooms full of them and tables of them waiting to come and sit down and be as honest as we can be and let you know the grit up under the bridge and what's really going on. When I go canvas with them brothers on the east side of town and what I already thought I knew in the city as far as crime and degradation and dilapidation, nothing until I canvas with them ETV brothers. Now I got a better understanding about intervention and the difference between intervention and prevention. Thank you.
Thank you, Curtis. And thank you for what you do, right? For the record, I'll never forget your name because that's my father's name. But thank you for, giving back to the community. What we know to be true is that a lot of folks that are in this work that are doing true CVI work are folks who have in the past caused harm to our communities and looking for redemption and restoration. And so grateful for you and the choice and the decision that you've made to partner in this work. All right, y'all ready to jump in? Community violence intervention. Really good question. Come on now, Jalen, you should have asked that on the mic. Community violence intervention. So let's talk about that for folks that don't know what community violence intervention is, because you're going to find out that you actually did know. We just gave it a new name a couple of years ago, right? So I call it community parenting. Anybody grow up in and I'm old, right? So anybody grow up in a neighborhood where everybody on the block knew everybody? You knew all your neighbors? Keep your hand up. Anybody grow up on a block where you had a block mama looking out the window of the second floor? Mine's was Miss Margaret. I ain't never gonna forget her, right? Anybody grow up in a block or a neighborhood where the minute anybody heard that it was about to be a fight or something was going on, everybody was swarming because wasn't nothing going down in their neighborhood? That's kind of community violence intervention at its core, right? It looks different nowadays because of the proliferation of guns in our community, drugs in Black and brown communities, the continued disinvestment in our communities. And so it requires a specialized skill set. That's why people with lived experience need to be doing the work. right? But community violence intervention is rooted in preventing the next shooting, preventing someone from going to jail for being a perpetrator, preventing somebody from having a non-fatal injury that their family is going to deal with trauma from, that they're going to deal with trauma from, or preventing someone from ending up in the morgue, right? That's what CVI is about. Any other high-level questions or comments about these pillars and strategies before we jump in? Come on up to the mic. Anybody else have any questions or thoughts? Feel free to line up behind the mic just so we can step through these.
How we doing? Nello Jennings.
I'm sorry.
Nello Jennings. Yes, ma'am. So my question would be, because I actually do intervention work for CVR, so I realize that a lot of times just lived experience isn't going to cut it with a lot of these individuals that we work with. So a lot of these situations get to the point where if we're not armed, then we're kind of just like trauma bonding or babysitting in a sense, the situation. So my questions would just kind of be about, for someone in my situation, how would providing training and technical assistance maybe be there to support us when it comes to these real life situations that might be a little overwhelming for even me, even if I can relate to them?
That's a really good question, Nello. Is my mic? Okay. Thank you for your question, Nello. Really good question. So that's actually baked into Pillar 1, Evolve Group Violence Intervention, and baked into Pillar 2 under Provide Training and Technical Assistance. So one of the things that we found when we delivered the landscape analysis for you all just a couple of months ago, folks in this room were a part of that whole thing, is that your CVI ecosystem doesn't include life coaching. Right? And I'm not talking about those people that's like, you should become an executive based on your degree, blah, 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 blah. This is life coaching for folks that are about to get shot or about to shoot somebody. That's about more than lived experience. That is intensive training focused on how you become an influencer in the life of someone that's about to be a shooter and or get shot. It's about how you use that influence to help that person begin to think through the differences around how you feel against what you think and then what you do in real time. So life coaching is one of the components of the evolution of the group violence intervention work, so that you're not just trying to stand on your life experience. And not to minimize that, but your point is well taken, that sometimes you gotta go a little bit deeper in order to make connections, especially those of us that are older in a space, right? In Baltimore, we call old heads like me the OGs. Y'all probably call y'all folks OGs too, right? We call our young folks young Jays. That's what they call themselves, right? And so being able to make a real connection in ways that result in them changing behavior, you being their first call when they feel disrespected and they're about to go light somebody up, and being able to intervene in the moment. Life coaching is very intensive. It means that folks have no more than 8 people on their caseload, that you're talking to these folks because they are imminently about to either shoot somebody or be shot, that you're talking to these folks at least 3 times a day, that you are seeing them in person at least 3 times a week is why the caseload is no more than 8. Right? And so that is baked into the provision of training and technical assistance that the OVP is going to be providing to community-based organizations that are interested in doing that work. I hope I answered your question. All right. Y'all ready to break out? Ready to stretch some pizza off? Come on now. All right. So I'm going to ask you all to count off. And we're going to count off 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, right? And then after we count off, the 3s will gather here. Sorry. The 3s will gather here. The 2s will gather here. The 1s will gather here. You all are sitting in groups with 2 folks on our team, right? You're sitting in a group with the person that presented the pillar from the OVP. Raise your hand if you're that person. Come on, director, get in your group. All right. And the other person that you're sitting with is a member of my team. Where's Team NICJR? I'll be back there in group 3 in a minute. The first thing that you all should do is designate who is going to be the person from your group to provide a readout on the microphone from the conversation that you all are about to have with each other. Okay? It will not be a member of my team or a member of the OVP. We want it to be a community member, right? We'll get there. I go. Are y'all really rock, paper, scissoring for it? All right. I go. All right. So don't pick the person now. I'm trying to give all the instruction out now. Easily distracted room, huh? All right. So you will pick a community member to do the readout after we have this breakout time from the conversation that I'm about to tell you all that you need to have on your pillar. You all are pillar 1. This group here, you're focusing on coordinating safety support services. This group is pillar 2. You are focusing on engaging in advocacy and program innovation. The group in the back, you are pillar 3. You're focusing on fostering collaboration and coordination. Yeah? I know that many of the folks in this room fall into this space, right? I very intentionally pulled you into other spaces because it's important that you're informing the work that's happening in spaces outside of your own. Okay? So for each of your pillars, here's what you're going to be doing. You're going to be having a conversation about the items in your groups, and you're telling us what we missed. What's not here. All right, we already had this high-level conversation, folks coming to the mic and saying we need to make sure these folks are in the room, we need to make sure lived experience is at the table, we need to make sure that training's at the table. That's great. But in order to make sure that the OVP is producing a plan that the whole community supports, you don't get to say after the plan is out that they missed something. You're in this room now to help us fill gaps. Does that make sense? I'm going to be walking around the room. Most of my time is going to be spent back here in group 3, but I'm going to be walking around the room. Know that the OVP person that's in your group with you and my team member that's in the group with you can answer any questions that you have about the pillars as you figure out what's missing. Because I'm going to tell y'all, is stuff missing? There always is. There's no way that a group of employees, 5 to 10 employees, is going to get everything right for a city of 900,000 people. So what's missing? Y'all good on the assignment? It is 5:50. We'll be having this conversation until 6:05, and then we're going to do readouts. That's 15 minutes. Go for it. Let's start with group 1. Who's doing the readout? Okay. Want to remind folks, let's get you over to the mic over here, just so we've got it recorded. Want to remind folks of what you were charged with doing. You were charged with communicating with each other what's not in your pillar that we need to make sure we get in your pillar, right? Because after we leave here, we start to synthesize your feedback, and then we start to solicit feedback from other groups of people in Columbus. Yeah? Amy, you ready? You ready? She's about to read out for the group. Are you ready? Okay. I got to make sure Amy's ready, y'all.
Yes, so my name is Tanika Goss. I'm reporting out for Group 1. Dad had the popular vote to read out. I won Electoral College to read out. So some of the things that the group discussed, they felt like were missing. Sorry, I lost my place. One of the things that came up, programs that encompass addressing the families that include sustainable funding. And so that means connecting family support services, because family sustainability is important when we're talking about servicing our youth, connecting that to a Medicaid model for funding. Another thing was sustainable services for those who do not qualify for insurance. So we're talking about the working poor who make enough money on paper to not qualify for services, but actually cannot afford those services. More follow-up services to the victim that help holistically to address what they have going on financially. One of the examples that came up is one of the fallouts of violence might be property damage, and they have to file an insurance claim and come out of pocket for those things. And we're talking about a lot of working poor people, wraparound services that are exempt of income. Collaboration with the Department of Education and more intervention workers who are placed on site at the schools full time. There is collaboration that currently exists with schools, however, they are not on site. Trauma and mental health services for victims and assessing families for resource gaps. And something that came up is instant access to counseling following interruptions that take place in the community. A lot of times there is a gap in time between when someone is requesting services or referred for services and when they actually get the service. Training more young people in the streets so they can come up to replace those who have been doing this work a long time, which speaks to the need of training and proper funding for this to happen, and the need for more trained interrupters who are disciplined and reformed. Curtis said very beautifully, I do my best work with people like me, and so having more trained and reformed interrupters with that lived experience is missing.
Thank you very much. Give it up for Group 1. That was a lot of missing stuff. We wouldn't have gotten that without you all having this conversation. And I would offer that some of the things that you mentioned span pillars 2 and 3, right? These pillars are intentionally intertwined. We're not going to be successful in implementing this strategic plan if all of these things don't happen in concert. Pillar 2, who's speaking for y'all?
So we did a lot of talking, but it was good conversation to get to. Sorry?
What's your name?
Oh, my name is Dante Sledge. Okay, Dante Sledge. Yep. Thank you. So I guess 2 of the major things that I'm going to report out on, I'm going to tell you what those are, but if I miss anything, can y'all please jump in? All right. Okay. So one of the things we came up with was just the interventionists and people that's working directly with, the community being trauma informed. I think that came from a question that was asked earlier. Then one of our group members suggested that. Just because when you're dealing with, you're working with people, just understanding what you may be seeing real time, you'll be able to better handle that. The other thing was figuring out a community foundation, Ebony. And part of that was, just essentially, just everybody kind of coming up with what does community really mean? We talked about family a little bit too. And it's like, if we're doing this work, we're working with people that's committing, some of these violent crimes. How can we get to the families? And if we're talking about the future, like you said, 5 years from now, there's some young people that we may not need certain types of intervention with. Like maybe it's just them having a mentor, having somebody. I'm adding stuff now, but that's kind of where my head was going with that. But they may not need somebody that has lived that life to kind of coach them to help get them out of that life. You know what I mean? It might just be somebody that doing fun activities. Like I mentioned that being at the Boys and Girls Club, was something that kind of kept me out the streets and things like that when I was growing up. So if we keep closing some of these places, where do kids have to go? And then on a higher, more intense level, people just having knowledge of the streets, the community, not just in Columbus. Am I getting that right? I can't remember. What's your name, Deshaun? Deshaun? No? Sean? Deshaun? Oh yeah, so yeah. And he was just kind of referencing like a lot of kids are following, some of these, people from other cities like Detroit and Chicago, and that's kind of what they're, but by understanding who they're looking up to, you have a better end to kind of break some of that stuff down.
Who's doing the readout for group 3? Oh, yes. Come on, Jalen.
Okay, a few things. My name is Jalen. A few things our group came up with: jobs for youth and adults, rec center, activities, after school programs, transportation, need more outlets for individual adults and youth, dirt bike trail, free gym time, meet the kids where they are, creating a venue they're invested in, creating experiences. And I wrote down for my last thing as a little joke, seeing how I'm in group 3, save best for last.
Thank you, group 3. Did we miss anything in group 3? All right, let's give it up for group 3. All right, so we've got about 10 minutes left in this discussion. I really want us to recenter the room because I want to talk to you about what next steps look like as it relates to this plan's creation. So I just want to reiterate a point that Raina made at the opening of this. This is not the first conversation, right, that the OVP has had with community. There have been several conversations. Some of you have been involved in those conversations over the past year. This is also not the last conversation. Conversation will look varied, if you will. So coming out of this discussion Raina will be partnering with our partners in the back to determine which portions of the video, if not the entire video of this discussion, get shared publicly and connected to a form that solicits feedback for folks that are not able to physically come into a space, right? That's one of the ways that you get feedback from folks who process better alone, right? Who need to see something and hear something a few times before they're able to process it. It also gives you all the opportunity to think through the conversations that you had today and figure out if you've got more feedback to give. So just because you were in the room today doesn't mean that you can't fill out the feedback form too. That feedback form, coupled with the feedback that you all have provided in any subsequent feedback sessions that the OVP decides to do, all of that will come together into the plan. It is why you see Amy taking very copious notes. We will work with the OVP to provide the plan back to them based on all of the things that we have heard. I want to be really transparent and say that as someone who received 700 pages worth of feedback in the Baltimore plan, all of it ain't gonna make it in, right? We've got to be thoughtful. I want to be real, right? We got to be thoughtful about what we can do in 5 years, number one. We got to be thoughtful about whether or not it's ours to do, or if it's another agency's or another department's or somebody else's to do. So if you share a piece of feedback and it didn't or doesn't make it in the future plan, I would encourage you to have a conversation with the OVP around where that landed. Hey, did it get handed off to this agency to handle? That's why it's not in the plan. Hey, because is it just not something that we're going to be able to get done in 5 years? And here's the reason why, right? The plan, when it's finalized, is not just going to be these pillars. It's going to be very specific breakouts of these pillars so that you know what's coming and you know how it's coming and you know how you're going to measure success. All right, so what does success look like? What are the key performance indicators associated with all of this? Is it, oh, you're spilling water all over yourself? Out.
Sorry. Wait, I didn't think she saw it, right? It's just running. You're supposed to ignore that.
The helper in me was just like, no. I lost my train of thought after that. Thank you. KPIs, key performance indicators. How do you know if the OVP, the partner agencies, the partner community-based organizations, the corner store owner, like, how do you know if all of this is working? Is it right? Because it's one thing, and I say this to folks all the time, it's one thing for your homicide numbers to go down. It's another thing for your non-fatal shooting numbers to go down. Those two things are very different than whether or not your community members feel safe or not. Psychological safety is as important as physical safety, because quite frankly, if I don't feel psychologically safe, I'm not physically safe. And so while this plan obviously doesn't own people's psychological safety, the work that is going to be written into this plan has to contribute to it. Right? So know that that's what next steps look like on this. Raina, I want to invite you to share any additional information that you've got with folks, including, what subsequent sessions might look like.
Sure. So first of all, thank you. You guys did amazing. You stuck it out. I know Shantae is not the easiest on people when trying to facilitate feedback, but it's for a purpose. And so we always appreciate your voices, whether it's at the convenings, at any of our previous community conversations. And I hope that you know and trust that the feedback that we are getting, whether it's myself, our CRCs, any member of our team, through anything that we do, no matter what you say, it doesn't fall on deaf ears. It is being taken seriously. And that's why, for those of you who may have participated in some of our previous community conversations, we have had 25. Today we'll make 26. We have spoken to almost 1,000 residents in the city of Columbus throughout those 25 community conversations. And they have spanned different locations, like I said before, and purposefully, so that we can solicit feedback from people who may not normally come to rooms like this, whether they can't physically because they're in prison or in jail, whether they don't have a vehicle to attend these things, or whether they just don't feel comfortable. And so we have taken all of that feedback in to get us to this point. And so we are hoping after tonight to hopefully host 1 or 2 Zoom sessions because we are getting a deadline from Shantae and her team of October 4th to get them the bulk of our feedback. So we will have that feedback form available online. Any of you are welcome to share it. We would ask you to share it if you feel so comfortable, so that we can continue to get feedback over the next week. And if we can, we will certainly have more online sessions, hopefully at least one through the lunch hour, so that people because we know people work, and so people can have that free afternoon space, hopefully. But we're never done taking in feedback. We should never be done taking in feedback, or we're not doing our work. So anytime you see any of us, please feel free to bend our ear about anything that you have to say about the work that we are doing. It might not make it into the strategic plan, but it could absolutely help us shape the work that we're doing through the things that are in the strategic plan. Other than that, do you have anything, any closeouts?
I appreciate you all taking time out of your schedule today to give feedback. Again, I want to remind you that this is not the last opportunity for feedback. Whether you give it directly to the OVP or fill it in the form or participate in the subsequent sessions that they are having, we know that violence is ever evolving in our communities. And so our responses have to ever evolve to be responsive. So, yeah, I'm going to thank you for your time.